Recording in progress. Those are great words. The only words I think that are better than those words are no problem. What do you think?
Well, I love recording in progress, so it's a good way to start the conversation.
I know, in fact, my friend Lonnie Hirsch, who is sitting on the far west coast, as I'm sitting here in the middle of the country. Lonnie, he and I have many conversations, Zoom conversations about strategy and healthcare marketing and healthcare practices, respective to the patient, particularly is an area where my interest lies. And one of the things Lonnie always does is he always records our conversations, and that makes sense because he can go back, review, and kind of helps him get a level set. So having said that, let me introduce Lonnie Hirsch, who, as you can see, is the founder, CEO of Forefront Healthcare Consulting. And here in a second, after Lonnie gives a little introduction of himself, I'll stop to share and we'll get into a conversation. Lonnie, who are you?
Well, Bob, my name is Lonnie Hirsch, and I lead a group of independent, or a consortium really, of independent healthcare business consultants under the banner of Forefront Healthcare Consulting. I've had this organization now since 2018. Prior to that, I founded and co-owned a full-service healthcare marketing and advertising agency based in Southern California, but serving a clientele all over the US and a little bit of international as well. After I sold that business, started to just do some consulting work around not only marketing, but also patient experience, patient engagement, other issues related to that patient journey, and found that there were opportunities to help not only healthcare organizations, although I've got a lot of history on that, but also help organizations like payers, health insurance companies, or also businesses that are fully insured, meaning that they are actually self-insured. They take care of funding the healthcare benefits for their employees. So that's really the big categories that the Forefront consultants work in.
So I'm going to stop sharing so that you and I can just sort of chit chat. Lonnie's, all of his contact information will be coming up on one of the slides. So we'll get back to sharing the screen. Lonnie, one of the things that I wanted to find out from you, you and I met last year at a SHSMD convention in Chicago, Society for Healthcare Marketing.
Society for Healthcare Strategy and Marketing Development, or Market Development, I should say.
I worked in the federal government. You would think that acronyms would just roll right off my tongue, but they don't.
That's not an easy one.
It's not an easy one, but it should be, because we're very engaged in that.
Sure.
Group also, as I know you are. And we were introduced by a friend of mine, a friend of yours, who is a friendly competitor. So that, and the only reason I bring that up is because it's important to note that in the industry that we work in, there are a lot of transitions, I guess, maybe not be the best word, but there's a lot of rethinking, reimagining the patient experience, which is an area I know that is very near and dear to your heart, and it's very near and dear to our checkbook. It's what we do, is measure that patient experience throughout the entire journey, to the point where we now have a white paper that addresses what we're calling enterprise feedback management. Now, it's kind of a new term inside healthcare, but the basic premise is, and this is where, Lonnie, you and I start to really get a great exchange of ideas and thoughts here. But the idea is if you're going to break down the silos, that healthcare is a group of silos in every organization. And each one of those silos has their own profession, their own professionalism, their own level of making sure that that patient is handled appropriately, but they don't share data. And so they can either break those silos down or they can share data. So, which is where the enterprise feedback management comes from. And it boils down to sharing of data across silos. That's my premise. That's what I believe after talking to a lot of people, after talking to you, looking at different forums, paying attention, I think. And so you've been around this industry much longer than I have. How quick to
Oh, I
adopt?
feel old now.
Well, I've been in hospitality longer than you have, so
Well, that's true.
we could even that out. But how quick do you think that this healthcare group, particularly marketing people, will adapt to that sharing of information so that they are heard and listened to?
Well, I think it's a great topic, Bob, and one of the reasons that I'm interested in it is, and just going back a little and giving a little history on my particular interest in patient experience and engagement and that journey. That really came out of the work that we were doing when I owned my healthcare marketing agency. Because what would happen is we would see that whether it was a healthcare practice or a hospital or another type of healthcare organization, they would want to engage marketing companies to help them attract more of the types of business that they wanted, more of the patients they wanted, more of the cases they wanted. And that's what we did and did well. But what we would also see is we would accomplish our objective of helping them attract those people. And then we would find that in many cases, the net growth for the organization wasn't substantially higher. And it didn't take long to figure out that that's because they were losing patients out the back door as fast as we could push them through the front door. And that mostly had to do with the quality or lack of quality of the patient experience. So we tried as an agency to get involved to the extent that the organizations would allow us to do that in helping them be thoughtful and strategic about how they crafted the patient experience, how they thought about it, and how they set themselves up for an optimal environment for that. But most of those organizations really didn't think of the marketers outside their organization as the people to help them do that. So as I started to watch that in more and more organizations, I really became pretty crystal clear on how consistently underperforming that patient experience was in healthcare settings. And there are a lot of reasons for that. And a lot of it has to do with the pressures and the stresses and the challenges of just delivering healthcare in today's environment, and even having the time to focus properly on the patient in the process of providing the care. So I certainly understand why all of those issues are happening. But as it kind of circles back to this whole environment of enterprise-wide sharing of data, I think the issue of silos in healthcare, particularly in health systems and hospitals, which is just, it's fundamental to the construct as it exists today, is that the sharing of information, it does not happen easily or often. And when you think about feedback, when you think about what you want to do with patient feedback, why you want to get that feedback and how you want to not only process it and understand it, but act on it, you realize that actually, if you can develop a process to take an enterprise-wide focus on data and on sharing of data on customer feedback, or in healthcare, mostly patient feedback, then that actually helps break down some of those silos. So it's accomplishing both the purpose of sharing of the information so that each part of the organization can hopefully learn from that feedback and use that knowledge to improve that patient experience, but it also helps foster more collaboration between parts of the organization. So I'm very excited about the topic, and particularly what you and I have been talking about more recently.
We know that that today, when we talk about surveys, the word survey, it automatically, what I've found is that people automatically go to HCAHPS. It's almost like it's by rote. Oh yeah, survey. Well, so and so does our surveys. Well, they're HCAHPS people, and that's good. So you have to measure the health experience. You have to measure whether or not that person left your hospital healthy, and then report that back out so that you can get your reimbursement. But what I found, particularly in the industries that we've worked with in the past, that patient journey, each time it's measured, has an impact on that final survey. And not every patient gets that final survey. I don't know what the percentage of patients is that gets the HCAHPS survey, but I do know that the percentage of people that complete that HCAHPS survey is very low. So
That's true with most surveys, isn't it?
No, actually it's not, because for
Oh,
instance,
okay. I guess it's true in most organizations as it relates to their HCAHPS responses, but
it is with the HCAHPS, and because it's so long, it's very difficult. I mean, a friend of mine in the call center business that does do that kind of work for different healthcare organizations, he describes the HCAHPS survey as that survey that when an agent is finished doing that work, they have to take a break and go have a cigarette, because it's a long survey to get completed, which is another reason, by the way, why CMS has said, yeah, we can now start to do it online, which is where we will in 25. That's where we're going to compete. But my point to that too is that if you're measuring the experience when somebody calls to make an appointment, and you start measuring that experience right there, you can start to manage and make predictable things that can happen to that next person and the next person and the next person. So as they're going through the journey, even when they show up at a clinic or at a hospital, by asking the question, was it clean? Were they friendly? Did they introduce you by your first name? All those questions go into a positive HCAHPS survey at the end of the day. It all sets that tone. And so each way through, if that call center survey results were shared with that clinic that said Mr. Hirsch was real happy about these things. However, they pointed out this. So when they show up, be mindful. These are some of the things. And so it's actionable. And because of now this wonderful AI thing that we have, even predictable.
yeah, that's actually when you think about HCAHPS particularly, that's a retrospective look back at experience. It doesn't really have anything to do with either measuring or shaping the experience along the journey, or it will be a point in that particular patient's journey when they receive that survey if they respond to it.
It's about it's really about their health. And that's the part that, at the end of the day, that's the part that is the most important measurement. Did you walk out of there feeling healthy? Did they fix your elbow? Whereas measuring that patient journey and those experiences along the way don't really have to have anything to do with the health experience. It has everything to do with the patient experience.
Right. But also to the extent in healthcare that depending on the patient's health status and their conditions, you can't always make them healthier. You can at least try to mitigate and get involved in not allowing a condition to get worse. But whether or not the medical opportunity in the intervention is to help them get healthier, you can help them experience a caring environment. You can help them feel better about being heard. And some of those issues actually, they certainly affect patients emotionally. So sometimes the emotional impact helps them actually physically feel better as well, depending on how severe their condition is. So I think it's really important that healthcare organizations not only are conscious of what that patient experience is at every point in the journey, but kind of going to our topic, how and where and when they get feedback at those different points of the journey, how it's shared, and what they do with it, that ultimately not only affects the HCAP scores down the road, but certainly could affect the patient's health as well.
You know, when we're building surveys, particularly in the hospitality industry, which is where we're happy to say that we're, and you know, interestingly enough, as a bit of an aside, Lonnie, the key performance indicators in healthcare and the key performance indicators in hospitality, when you're measuring the experience, are very similar. And you know, because it's all about measuring that experience. How was it? Was it pleasant? Was it friendly? Was it nice? And so with the enterprise nature of capturing the feedback, one of the things that we could say, because we're consultants at our core, we always want to ask the question from our client, what does the C-suite want to hear? What do they need to know? What's going to get them to pay attention? What do your marketing people? What do your patient experience people? What do your call center people? So you're doing, you know, a survey that everybody, every stakeholder has a little skin in the game. And that's what gets your marketing people listened to, the patient experience people. It gets them heard because now all our stakeholders are engaged, not just involved. You know, the old line, the chicken is involved, the pig is committed.
Right.
Everybody, you want everybody committed if you could get them committed.
Absolutely.
So, you know, and you and I are hoping that we can present this at the next Shishmid conference in October.
Well, I think it's a topic that's very worthwhile for people. I mean, certainly Shishmid is primarily people who work in some aspect of the marketing organization in the hospitals, although it's certainly an organization that also includes people who are involved in business strategy for the organization, for the hospital. And in both categories, the ability to capture feedback at different points in the journey and process it. Yes, of course, it has a potential on positive impact on the HCAP scores, but it also has so much to do with how the organization communicates with their audience, and not just in a broad way, but also, and you mentioned the advances in AI, the ability to narrowcast now and communicate directly to individual patients based on their individual circumstances. All of that as a part of the marketing responsibility, certainly of the organization, or even those who are the strategists, is very important data for them to have, not just for hopefully impacting patient experience, but also for how they develop and maintain relationships during that journey, because patient experience, if you want to think of it that way, happens inside and outside of the patient's activities with the hospital or the clinic that the hospital owns and manages. So you have to maintain a relationship between episodes of care. And it's,
And with
you
all,
know, it's important how you do that.
and bring in all the stakeholders.
Absolutely bring in all the stakeholders. And that's why the whole issue of circling back to the enterprise approach to it is, it's not just, it can't just be one individual or one department's responsibility to own patient experience, if you want to think of it that way, because ultimately it happens at every touch point and in every kind of an environment. So if the organization is not aligned around that, and it's difficult, particularly in healthcare, it's difficult to be consistent with that kind of focus. But to the extent that one part or one department, I don't want to use the word silo, because I'm trying to think outside that box, but any one area of the organization can not only capture and use feedback that's relevant to the way they work every day, but in sharing it, they can actually learn from other parts of the organization that are also getting feedback that can apply to their own knowledge and their own ability to apply that knowledge. And that's why the sharing of the feedback, I think, is so important. And it's not just, well, this part of this survey is going to go over to this clinical unit or this department because it applies to them. Because then you're essentially reinforcing the limited perspective, and that limits the opportunity to improve.
And the one thing, I mean, among other things that the HCAP survey won't give you is it won't tell you whether or not your brand is being helped or hurt, whether or not, you know, you're establishing loyalty among your patient base. You know, loyalty will help you make your marketing dollars more efficient and effective. You don't need to cut them, but you can make your messaging even that more crisper and sharper. And, you know, I do know that, for instance, Hilton and Hyatt and Marriott and the big hospitality brands, their primary purpose behind measuring that feedback is the brand. It's about the brand. It's about that sign on the wall that says this is a property that you can rely on for a positive experience, which is, to me, the goal of measuring any patient experience. Bring them, you Lord knows you don't want them to come back, but you want them to come back if they need to come back.
Well, you certainly want to be the ones that they think of as they associate the health quality and the experience quality. So, you know, certainly healthcare organizations, particularly hospitals in this context, are also concerned about that Net Promoter Score. But the Net Promoter Score, just like the HCAHPS scores, are all being impacted by every experience, and everyone in, and this I know you know this from your hospitality experience, everyone in a service business is a representative of the brand, whether they want to think of themselves in that way or not. They are a walking, talking, living, breathing representative of the brand, for better or maybe for worse. So when you think about, I mean, this is something that we talked about a lot back in the days when I had a marketing agency, and we used to actually do seminars in different cities and workshops in different cities with healthcare organizations around their marketing. And one of the points that we were we're constantly emphasizing is that the marketers are thought of as the brand representatives, but in fact, everyone in the organization who has any contact with or any influence on that patient perception is a brand representative. And I'm not just talking about the clinical team. I'm not even just talking about the call center team. I'm talking about people in billing, any administrative function of the organization, even if they don't speak directly to the patient, but something that they are doing is having an impact on those patient perceptions. That's a brand touch point.
No,
It can be a positive one or a negative one.
that brings up a couple of thoughts that are, the one thing is the third rail, that's the billing.
Right.
You know, it's one of those questions that in surveys I haven't seen it get asked. And that might be something that people will, hospitals, that organizations, healthcare may find out that one of the biggest reasons that they lose loyalty is because the bill was messed up. They don't ever ask that question. But as
or the ability to actually address the patient concerns around the bill. And it may not be, it may just be that they don't understand it. They need it explained to them. I mean, insurers have this issue all the time as well. The health insurance companies explaining benefits as well as the bill to a patient. That's all. Those people are customer service representatives. Those people are brand representatives, but they don't, not only do they not think of themselves that way generally, but they're certainly not trained or recruited with that consideration. But the impact they can have is profound. And you're right, it isn't typically asked on surveys. And so you don't necessarily capture that feedback unless it's volunteered.
You know, when you were talking about the brand, my mind just automatically shifted toward this old, probably written in the 50s, book about marketing by a guy by the name of Marshall McLuhan. You remember that name?
Where I can remember Marshall McLuhan, yes.
He wrote a book called The Medium is the Message.
Right.
Or Message, depending on, but he kind of extended everything. What he said was, he said the footprint, I'm sorry, the foot is an extension of the gas pedal, or the gas pedal is an extension of the foot.
Right.
And so everything is tied together. I need to dust that book off. I've got to read that again, because I bet there are some real jewels in that thing that exists today. We find some of the most wonderful, Theodore Levitt wrote a paper called Marketing Myopia. That was another one that is so germane today that, we get stuck, we get mired on, this is what our message should be. And we don't bother to listen to what the message really should be. And that's where the survey comes in. Backing up 1 second, then I want to move on to something that's very near and dear to both of us. But backing up a second, going back to the surveys and the response rates. Response rates are, rule of thumb, researchers will say, if you get right around a 10 to a 30% response rate, you have enough to make sound business decisions. That's why rather than measure in HCAHPS, rather than measure in percentages of responses, they measure it in percentages of number of people that take the survey against the number of people that you treated. So if you treat 1,000 people, we need 100 surveys. Versus if you do it right and you know how to manage the timing of the survey, you could get to a 30% response rate.
Right.
You get to a 30% response rate pretty regularly, particularly when 3 or 4 days after a survey goes out and it doesn't get replied to. We send that reminder, very gentle nudge, because people actually forget. That's that reminder is where we get most of the surveys, and we do it in such a way that you don't create fatigue It's fatigue that causes those rates to go down. The affinity causes them to go up.
And I guess I would ask you, Bob, being, this is your area of deep experience and expertise. Are responses to surveys, because I think about it in terms of being someone who receives them, just like we all do, are the respondents those, or more skewed certainly toward those who are either those who have had a really positive or a really negative experience in a relatively recent period of time to receiving the survey?
Yes.
Okay, because in this issue of, you think about survey fatigue and you think about how many surveys we're asked to take and how much, I mean, nowadays you can't have an interaction with any company customer service department on a phone call, certainly the big companies, without being told, you may receive a survey at after this call, and we really appreciate your feedback, or they'll say, appreciate your feedback about how you felt I handled the call, or whatever it is. So we're getting that all the time. Well, most of the time, most people are probably feeling either too busy to deal with it, or it's just not that important to them. But I do know, and I'm just, a sample size of one, I do know the ones that I tend to respond to, it is because I had a uniquely positive or uniquely negative experience that I want to give feedback about, that may or may not have even been that particular topic of what I was talking with the agent about. So I think that's a really important question in terms of how healthcare organizations should look at what they survey patients about, how often, what's important to ask, what's going to drive more fatigue rather than more response. And that's your
Well, that's where A/B testing comes in, Lonnie. As you know, from your experience and deep experience in
right,
marketing, what you start with is never what you end up with,
right,
and nor should it be. In the case of surveys, what gets knocked around quite a bit is the net promoter score. It's passe, it's this, it's that. But when I look at the promoter score, I look at the 7s and the 8s. Those are the passives. Those are the people that make you scratch your head and wonder why they take the survey in the first place.
right.
But then when you say that you're a sample of 1, you're actually a sample of 70 out of 100. We in politics, they call it voting with your feet. You're actually part of the equation when you don't vote. And you're as much a part of the equation when you don't vote or don't take the survey as you are when you do. So it's all that has to be a part of the calculation. And it is part of the calculation.
So I know you wanted to segue into a related topic, and I had some additional thoughts too, but I don't want to jump ahead. So where did you want to go with the conversation?
I want to go into our charities.
Oh, okay.
And I always have trouble with this because of the way the screen sharing works in Zoom. So I want to be able to share the whole thing, but you know what? This will happen.
You're doing a fine job, Bob.
Thank you very much. I appreciate that. What I would prefer to do is have this thing as a slideshow, and I'm not exactly sure how to get that done. So we'll just look at my whole ugly screen as it is. And so one of the things that Mobius does that we do, and Patients Count is very proud of this, is that and your charities will end up on our website also into what we call sharing is caring. That QR code on the left will take you to the sharing is caring website, and we always contribute. I contribute $50 to each charity of choice for the guest, as a way of thanking you for your time, because I can't afford to pay you a lot of money, but I can afford to support the charity, which we're happy to do. That's our DNA. And so you've chosen 2 of them, and And I really would like to see if I can.
You just have to go to slideshow. There you, yeah, just advance the slide and we're good. There you go.
Okay, so the two that you've selected, which by the way, typically it's one, but it doesn't. As long as we're doing charity, let's do as many as we can do. So talk about this one, Lonnie.
Absolutely. So one of the two organizations that, first of all, Bob, thank you, and thanks to Mobius for even having this kind of initiative, because I think it's unusually contributory to improving, in this case, healthcare. And I have I have actually a lot of organizations that I support and feel strongly about, but that's why I came back with an answer of two when you really only asked for one. But this one, the National Alliance for Caregiving, is really an organization, as it says, it's a coalition actually of organizations that are supporting family caregivers. And this is a particularly high priority focus for me, not just because in my personal life I've dealt with and continue to deal with helping other family members who need support in and actually physical as well as emotional support in the home, where there's a lot of burden that falls on the family members, the loved ones. This is not only not unique to me, it is in fact a growing, I hate to wax hyperbolic here, but it's really a growing tsunami, in my view, of what's about to hit the US. Because for one thing, if you just look at the demographics, 10,000 Americans every day turn age 65, and that is going to continue through the year 2030. And that means also those who are aging and age in the home, either by choice or by circumstance, they put a big burden on family members to help take care of them. It's an emotional burden, it's a physical burden, it's a time burden, it's a financial burden, and family caregivers are just kind of, for the most part, left on their own to figure it out and to deal with it. And if you haven't had that experience in your own family, you're going to. And there's very little institutionally right now that is there to support the people who have to take care of their loved ones. But there are organizations that are trying to do something positive about it. And this is the National Alliance for Caregiving, is one of those organizations that I particularly think is doing good work, because they are a coalition. So it's not just one organization, it's a group of organizations that are trying to fill a gap here.
So it's a national organization. And do they distribute funds? What kind of support do they typically give somebody that is
that's a great question. Yes, part of it is financial, but part of it is just being a place to direct people to resources. Because as I said, family caregivers, family members are often left on their own to figure out, where do I go for this? How do I deal with that? And they feel very alone. And there's really, it's like they're Googling their way through it, or they're talking to friends if they know other people that are going through something similar and are further along in the process. So being a repository and a director of resources as well as some funds is a really high benefit in an environment that you want to talk about fragmentation. It's not even formed. It's like It's like, when the universe was just being formed and it's just this gas cloud. You can't even, make sense of it at all. So I think that's important work.
It's kind of like nobody mourns for the mourner. You know, we spend a lot of time taking care of the people that are maybe ambulatory but infirmed at the same time, or could be any type of malady that they just need help. And
Yeah.
that individual that accepts that, picks up that gauntlet, because it is a challenge. They need that support. They need help. I know I've been through it, and my wife and I just went through it, and it's hard. It's very, very hard. So this is a good one. I like this one. I was happy to contribute to this one, and hopefully some of the people that will listen to this podcast will kick in also. So let's go to the next one. You want to?
Sure, I'm ready. So
Yes.
the Association for Frontotemporal Degeneration. This is a mouthful. A lot of people had not heard about this. It is still categorized as a quote unquote rare disease, but it affects a lot more people than most of us are aware of or have even heard about. And it's starting to get more attention now, specifically because there are several well-known media celebrities that unfortunately have been diagnosed recently with FTD, among them Bruce Willis, and even more recently Wendy Williams. This is a really tough, insidious disease, and depending on it's a form of dementia. It is not Alzheimer's. It affects people's physical and mental capabilities, and there's a few different variations of it, depending on which version of it the individual has. It will manifest in different kinds of behaviors, their ability to speak, possibly acting out in very uncharacteristic behaviors that would previously have been not part of that person's makeup or personality. There's so many challenges with this disease, and I just felt like, knowing again several people who are dealing with family members who actually have this particular condition, I felt like any opportunity to help publicize it, I wanted to take advantage of that opportunity.
The sad part, but also, I don't know if there's anything fortunate about this, but we didn't pay much attention to Parkinson's until Michael J. Fox came out, and now,
Right.
fortunately, there's a lot of more attention being paid to it, and it's true with this one too. And I did not. I scanned what's up with Bruce Willis. I didn't really pay that much attention to it. And then when I saw the article about Wendy Williams, and they said it's the same thing that Bruce Williams had, I started to drill down a little bit more. And now with this, I don't know how prevalent it is, but it's prevalent enough that it's capturing a lot of the attention of the people in the news, which therefore then means that it's something that the rest of us are going to be aware of and should care about.
Well,
So,
again, Bob, I just appreciate you and Mobius for supporting and highlighting these issues, and it's a unique opportunity to share about it, and I appreciate it.
well, I did some work in Sweden several years ago, and I was talking to my cohorts at that time about nonprofits and charities, and I asked them how do your charities raise money? And they looked at me and said, "We pay a 70% income tax. Are you nuts? Government takes care of all that." So we don't have that in
That's
this.
right.
It's up to us. So it's my pleasure to do it. I hate to have to do it, but I'm glad we have a vehicle to do it. So So as a kind of a wrap up here, this is all your information, Lonnie. If you were gonna identify somebody that you said, well, I wish they would call me for business today, who would that be? And don't say me, we're already doing it.
Thank you, Bob, and thanks for the question. Actually, I have a two-part answer to that. The first deals specifically with Forefront, which is the consulting organization that I lead. The people or organizations that usually reach out to us and ones that I would invite to are those who are addressing issues around the patient journey, around patient experience, around patient engagement, around marketing, communications to the patients. But we also, because it's a consortium of consultants with different areas of expertise, we also address technology innovations. We address issues like converting from more of a fee-for-service model to more of a value-based care model. It's a pretty broad spectrum of consulting expertise, but particularly if I would ask people to remember one thing, it would be if it's around the patient experience, patient engagement, patient journeys, or communications related to that, we're a good place to have a conversation about that. The second part of my answer is not represented on this screen because it's a really new initiative, but I'm also involved with some very committed people who are working on a new project called the Healthcare Reinvention Collaborative. And really, it is a burgeoning organization that is dedicated to connecting and supporting different initiatives, efforts, and organizations that are working on different aspects of not only improving healthcare, both the delivery and the experience of it, but actually rethinking it, reimagining it. That's why it's called Healthcare Reinvention, because we, as many people have come to the similar conclusion, see so much about the existing healthcare system as broken, frankly, and tinkering around the edges isn't making an impact. Minor improvements, minor changes. It's like trying to plug a big hole with not nearly a large enough plug. So we're excited about the work we're doing with HRC, and we'd also like to encourage people to check us out. We have a new website called healthcarereinvention.com, and you can learn more there.
Kind of like the enterprise feedback management, connecting silos would be a way to reimagine. And I would be remiss, I think you and I would both be remiss if we didn't give a little shout out to Denise Wiseman's group, the whole patient experience
community, right? The patient experience community.
Yeah, that's one where and she identifies it as creating a ruckus. And you know what? I think I like that. I mean, that puts a little excitement into it. That puts some, let's create a ruckus. Let's shake it up a little bit.
I'm glad you called that out. Denise is a co-founder of the Healthcare Reinvention Collaborative, and just like with the PX community, we are ready to make a ruckus, and we're going to do it. So thanks for mentioning her.
Oh, I'm a part of it, so I know
you are
totally in.